Good morning. My name is Jacqueline Shafe. I'm a medical epidemiologist. I'm from Trinidad and Tobago. It has been both a privilege and an honor to be part of the Leaders in International Health Program, part of the 2010 cohort. As our program has come to an end, I was asked by one of the mentors to comment on 3 international health issues as I see them. Being from the Caribbean and having been involved in health for some time, in my opinion, I believe these 3 issues are of prime importance, both in the Caribbean region and globally. And I named them in terms of violence and crime. Anywhere you look at on any major newspapers, you find that coming to the fore. In the Caribbean, we have a lot of crime and violence, and in particular in Trinidad and Tobago, we have noticed an increase in criminal activities, especially among the youth. And when I say among the youth, I'm talking between people in their late adolescence into about age 50 thereabout. And in my opinion, because of proliferation of gangs, availability of weapons, guns, and the right, and also because of trade, illegal trade. And by illegal trade, I refer to trade in narcotics, trade in arms and ammunition, because as you know, in Trinidad and Tobago, we do not produce guns. But then how do the guns get into the system? So if you look at it internationally, trade comes in, narcotics comes in, and in that fashion, guns come in. And because of what I can refer to as tough, people maintaining their territory. So you have mushrooming of gangs. And that has led to a lot of crime, a lot of violence, a lot of fatality, which national security is trying to cope with. But then it has to be a multi-sectoral approach. You have to look at the social programs that are there for people who dropped out of school, people who don't have, how will I put it, people who live in depressed area. It cuts across ethnicity. Because in Trinidad and Tobago, we can't say it's a particular ethnic group or whatever, but then we have to look at the social economic status and a number of issues. So again, for me, crime and violence, as it goes hand in hand with illicit trade, is a major international problem that is facing not only Trinidad and Tobago, not only the region as CARICOM as a whole, but a global issue. Another thing I will want to mention is access to medicine, right? And in particular, because I work in HIV as a policy maker, as a planner in the Northwest Regional Health Authority, which is one of the regions in Trinidad and Tobago. We have 5 regions. So I work in Northwest Regional Health Authority. In terms of access to medicine, when people talk about access to medicine, there is a tendency to think in terms of the prescription medicine alone. Now that goes beyond. Again, I will want to use HIV/AIDS because that is the area that I work in. Now, when we talk about access to medicine, internationally, all countries are not the same. In terms of development, in terms of their GDP, in terms of empowerment of their population. So in terms of what is the government doing to make access to medicine easily available to everybody that needs to access the medicine. Now I'm saying in terms of HIV/AIDS, if I go back and I use Trinidad and Tobago as an example, we have vertical programs. So if you drill down globally, because of copyright, intellectual property and stuff like that, certain medication are not readily available to the population that needs it. Either you're looking developing country versus developed country. So you have issues of royalty, you have issues of how much of the GDP is actually assigned to health. And within health, you have to look at the different diseases and how you appropriate pieces of the budget to them. So in terms of HIV/AIDS, yes, it is. In order for us to win the battle or to stem the epidemics of HIV/AIDS, there has to be a better access to medication, right? And medication in terms of the prescription medication, in terms of the support system for you to make that, to make better utilization of that medication. And by that, again, I will reference my country, Trinidad, and my adopted country, Trinidad and Tobago, because yes, the government makes access to HIV medication available. It is free of charge. We're very grateful. It's a wonderful opportunity for those that are infected and affected by HIV. But then concurrently, before I can be placed on the medication that is suitable, or before I can place a client on the medication that is suitable for them, I need to know what is your resistance profile. So we have access to medication, but the support system to make better utilization of that access to medication is not there, because we have to send our resistant testing for HIV clients to Puerto Rico and that kind of a thing. So, you know, so when we look at access to medication, we have to look broader, not just the tablets and this and that, but we have to look at the laboratory support. Do we really have that? If we look in terms of Trinidad and Tobago, Tobago does not have certain infrastructures, and Trinidad has. So in terms of quality of life for the people that live in resource-limited environment, we really need to look at it and try, again, international health with equity at the center. If we're really looking at that core equity, then we have a lot more work to do in terms of access to medication, all right? Again, apart from the support system, we also have to look at somebody with HIV/AIDS is an individual, but concurrently they could have other comorbidities. So how it is that we're coping with that comorbidities, not just access to medication for HIV, but access to other types of medication, right? So, and that brings me to the third thing that I think it's very, very important. When we're looking at, no matter whether your country is socialist or capitalist or whatever, you have to look in terms of the resource you have in terms of human resource, and the issue of migration, in particular healthcare professional migration. It's a key issue that cuts across wherever, whatever region of the globe you come from. If you look at Africa, if you look at Caribbean, if you look at Asia, the world as a whole is a global village. People move and they move and they move. And also because of different agreements that the different countries are signatories to. Again, I will reference Trinidad and Tobago. We're part of CARICOM, we're part of Caribbean Single Market Economy. And with that, it gives the opportunity. The principle is that people will be able to move across borders so that there will be better sharing of limited resources. But then what that has done is that it will open the door for expertise from one region to move across to another region, which in principle is a good thing. But currently, because where you have resource-strapped countries, then there is this issue of brain drain. So migration, we are losing some of our trained expertise. They're going where the grass seems greener on the other side. And again, do I blame them? No, it depends, right? If you're trained, you don't have the necessary tools, you don't have the supportive environment to practice what you're trained to do, then it is very frustrating. So again, looking from the inside, I do not blame those that migrate, right? But then, what can we do to stop the hemorrhaging of expertise from a particular region to the other. So again, maybe South-South collaboration, Caribbean collaboration, if you make an enabling environment, right, that, well, environment goes beyond dollars and cents and compensations, in my own opinion. If we make the environment a little bit more suitable, that you have access to the medication, you have mentorship program, you have opportunity for research, the crime issue is lower, then maybe people will not readily migrate. I'm not saying people will not migrate. No matter what you do, people will migrate. But then, as we'll try to level the field, because if you work in an environment where on your way to work you could get shot, you could die. Remember, you have only one life, and the only time you can impact international health, the community, whatever, is when you're alive and well. So if we look in terms of the security of healthcare professionals, national security in certain hot areas, right, then maybe then the healthcare professionals will not readily migrate. And migration is not just international migration, as in you're migrating from Africa to Caribbean, or from the Caribbean to Caribbean. You also have within country migration, such as you're migrating from the rural area to the cities. And if the city is too hot, you have gang issues, you have, all right?